Today, my team and I will meet with our counterparts to make sure the priorities of Ontario remain top of mind here in Ottawa. And we are here at a critical time, not just for Ontario, but for the whole country. We're all in this together, as I said. We have to stand united as a country, make sure we have each other's back and support each other.
One of the first things we're doing is setting up separate assessment centers so that people who want to be tested to see if they have COVID-19 can go to these separate assessment centers. We have 6 that are set up, including one in Ottawa. Within the next several days, more will be established across the province very shortly. We want to make sure that that doesn't put extra pressure on hospital emergency departments. We're very fortunate in the sense that the vast majority of people who have tested positive have not needed to be admitted to hospital. They're at home in self-isolation and they're being assisted by the public health units. However, all hospitals have the ability to admit patients should they need to be admitted for COVID-19. They don't all need to be treated in negative pressure rooms. They can be treated in isolation in other parts of the hospital, and our plan includes the availability of spaces in all of Ontario's hospitals should the need arise.
How separate are these and what will they look like?
It's a separate facility close to the hospital. So it's really meant to take the pressure off the hospital emergency departments and to keep the people who may have COVID-19 separate from the general hospital population, because you don't want it to be spreading there. So as I indicated before, we have 6 that are ready to open within the next few days, with more to open next week as well. We know that it's important to ramp that up. We're also looking at, we've expanded some of the OHIP codes for physicians as well, so that they can do consultations over the phone to speak with patients to determine whether they need to go in for testing or not. So we want to take the pressure away from the hospitals as much as possible, and so that if people do need to be self-isolated, it makes it easier for them to be able to do that.
At a time when public health units are advising social isolation, telling people to kind of stay away from each other, to distance themselves, do you think it's a good idea for the premiers to be all in one room with the Prime Minister here today in Ottawa? And do you have any plans to potentially cancel or suspend Queen's Park?
Not right now. Again, we're measuring it day by day. The situation is changing day by day, so we'll be measuring that. But we look forward to sitting down with the premiers and the Prime Minister.